Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about adenomyosis as well as endometriosis. And as always, before we get started, go ahead and check out the new group, link in my bio, that I made so that we can all get together as a community of expectant as well as current moms to talk about all things ultrasound, as well as get a little bit more education on the ultrasound side of things with pregnancy. Anyways, back to adenomyosis and endometriosis. So I know these two are a mouthful and they kind of sound similar, but you can think of endometriosis as basically the endometrial tissue growing outside of the uterus. For those of you that don't know, the endometrial tissue is actually the functional layer that sheds every month in your uterus. So that is the lining of the uterus. You can think of endometriosis as having that lining of the uterus being outside of the uterus. So basically, that tissue that should be shedding every month, it doesn't just stay in the uterus, it is implanting somewhere outside of the uterus. Versus adenomyosis, which is similar but different in the way that it is endometrial tissue that is outside of the endometrium in the uterus, but it is still within the uterus. Hopefully that makes sense. So the adenomyosis is where that endometrial tissue actually ends up in the muscle layer of the uterus, versus the endometriosis, that is where the endometrium is outside of the uterus altogether. And adenomyosis is considered a subset of endometriosis, but without further ado, let's just go ahead and dive into mostly endometriosis. I'll touch a little bit on adenomyosis too, but you can apply basically everything that I'm saying with endometriosis to adenomyosis as well. So we're just going to really focus on endometriosis here today. And then at the end, we'll go ahead and take a look at some pictures of both of them. So, with endometriosis, as I said, this is where the functional layer of the uterus actually is outside of the uterus. And this is not good because those endometrial cells that grow and expand and respond to hormonal changes every month and are supposed to be expelled every month, they are not. And instead, they are stuck somewhere outside of the uterus. The most common place is going to be on an ovary, and it basically ends up growing and making a cyst called an endometrioma. Other areas that it can end up is in your peritoneum, which is going to be called superficial endometriosis, or it can end up in other places with deep endometriosis, like your GI tract or your urinary tract. And as you can probably imagine, having this endometrial tissue in places other than your uterus is not a good thing. Not only does it cause some irritation usually to the surrounding tissue, it can also end up causing scar tissue and forming adhesions. And although there are a couple of main theories as to how this endometrial tissue spreads to other parts of the body, there isn't actually a consensus as to exactly how it happens, which is obviously frustrating because we don't actually really know the means of transmission. And same for adenomyosis as well. We don't really know exactly how it happens, but we do know that women who have both adenomyosis as well as endometriosis, a lot of the time they have pelvic pain, which is a pretty common symptom among both of them. And infertility is also a big one as well with endometriosis. Approximately 40% of women who are experiencing infertility are actually suffering from endometriosis as well. And all the symptoms that come with endometriosis can be really vague, which again can be really frustrating for the patient because they are having all of these vague symptoms that could be due to a number of things. And in reality, it is actually just due to that endometrial tissue that is implanted outside of the uterus. And a few examples of this is going to be pelvic pain that is usually cyclical. But again, just because somebody has pelvic pain with their period does not mean that they have endometriosis. And if that is the only symptom that they present, then they are not going to be really diagnosed with that condition until further tests are done or until an ultrasound is done so that we can see what their uterus actually looks like and see if there are any endometriomas hanging out in their ovary, etc. Also, if you are having any sort of urinary issues, it could also be endometriosis. It could mean that that endometrial tissue actually implanted into your urinary tract. Even if you are having chest pain or having pleural effusions, which means there's fluid on your lungs, that could hypothetically be from endometriosis, as in that tissue went ahead and implanted all the way up in your chest cavity, which is really crazy to me. So, anyways, it can implant basically anywhere in your body, and usually the symptoms are going to be pain or some sort of irritation in that area. But with all of that being said, many actually don't have symptoms at all either when they have endometriosis or adenomyosis. And it isn't until we do an ultrasound or it's found incidentally that we think, maybe that's actually what you have. And especially when endometriosis is of the superficial varieties, as in it is in the peritoneal cavity, a lot of the time that is asymptomatic. And using ultrasound, we usually are pretty bad actually at detecting endometriosis unless it is on the ovaries in the form of an endometrioma, which again we'll go over a little bit later on in this video. But if it is implanting into the peritoneal cavity, we have a really tough time seeing that on ultrasound, as well as if it is deep into the pelvic cavity or anywhere else. Again, ultrasound isn't great with seeing that. Adenomyosis, however, it is a little bit easier for us to be able to see that on ultrasound because a lot of the time it does appear as a heterogeneous myometrium, so that muscle layer that the endometrium is implanting into. It does look less homogeneous to us than what it should be, or it has a streaky appearance. So adenomyosis is definitely a little bit easier for us to detect on ultrasound. And again, unless endometriosis is on the ovary, a lot of the time it is really non-specific to us what it looks like on ultrasound otherwise. Also, for treatment options, a lot of the time surgery is going to be one of the best and obviously permanent options for treatment, whether that is going in and actually getting out that excess endometrial tissue that should not have implanted outside the uterus, or having a hysterectomy altogether to get rid of the adenomyosis. Either way, surgery is definitely one of the things that can cure it right away. But also, a lot of women do go on hormone therapy to try and control the endometrial tissue and to lessen the pain every month. But obviously, all these treatment plans are going to be different, and it also depends on your symptoms as well as the severity of it. But if you are experiencing infertility, then one of the first things that they're going to do is refer you for an ultrasound so that they can see whether or not there are symptoms of adenomyosis or endometriosis on ultrasound. And if there are, they can go ahead and proceed with treatment accordingly. So let's go ahead and start off with adenomyosis and what that could look like on ultrasound. For reference, this is going to be a normal ultrasound picture of the uterus, and these are adenomyosis on both sides of me. And just for reference, this is going to be the endometrium right here, so that is just that white stripe that is going along the midline of the uterus, and the rest of this is all myometrium, so all of this is the muscle layer of the uterus. You can appreciate that the muscle layer of the uterus, basically all around where that endometrium is, again, this is the functional layer that sheds every month. All of this tissue that is surrounding it here that makes up the majority of the uterus, so the muscle layer, is pretty homogeneous. There's not really a lot of variability in the texture of it, and it looks pretty even all the way around. This is different than this uterus here that has adenomyosis, and you can still appreciate that there is that stripe in the middle there still. That's where the endometrium is. But all the surrounding tissue around it, it is heterogeneous. So it doesn't have that nice smooth appearance, as well as do you see these streaks kind of coming down here? So those shadows, that is definitely indicative of adenomyosis. Looking at this uterus in transverse, it usually is more obvious when we are seeing a short axis essentially of the uterus. And again, you can see it is all just heterogeneous here. It's not really smooth looking, as well as, again, you see kind of those shadowy streaks all throughout the uterus here. And now let's look at the most common form of endometriosis, which is going to be an endometrioma on the ovary. Up here we see a normal ovary, so just right over there, just that circular thing. You can see all these normal little follicles around here, and this is a normal ovary. As opposed to this ovary here has an endometrioma on it. So it is just this really big kind of grayish circular area within the ovary, and that is that endometrial tissue that has implanted in the ovary and is making this large cyst-like thing. And usually this will be large as well as very painful for whoever is experiencing it.